Hey all, today we are going to discuss about developmental disturbances in the shape of the teeth. So the first topic is gemination. So in gemination what happens, there is an attempt of a single tooth germ, right, to divide into two. So basically there is a division of a single tooth germ by an invagination that results in incomplete formation of two teeth, right? Normally we know that there is a dental tooth germ, or this is the enamel organ, this is the dental papilla. So this is a tooth germ which gives rise to only a single tooth. But what happens in gemination, there is an attempt to divide into two teeth. So there will be an attempt which results in incomplete formation of two teeth, right? So the structure is, there will be two completely or incompletely separated crowns. So here you can see the separated crowns present, right, with a single root and root canal. So this is the single root and only a single root canal will be present in gemination, right? Now the term twinning. Twinning is basically a form of gemination in which what happens, if we try to divide a geminated tooth, right, it results in a normal tooth and a supernumerary tooth which are equivalent in size. So what happens in gemination? There is a single tooth germ. There is a single tooth germ which tries to divide into or attempts to divide into two teeth and leads to incomplete formation of two teeth, right, with completely or incompletely separated crowns. So the next topic is fusion. So in fusion there is union of tooth germs, right, two tooth germs, right? So there will be a union of two normally separated tooth germs. It can be complete or incomplete, right, depending upon the stage of tooth development, right? So if the fusion has occurred in early stages, so tooth may be completely united to form a single large tooth, right? The crown and the root will be fused. But in later stages, if fusion occurred between the tooth germs, then union of only roots may occur, right? It is more common in deciduous dentition. It may also occur in normal tooth and a supernumerary tooth like mesodents, distomolar, etc., right? So it is different from gemination. In gemination there was a division of a single tooth germ, but in fusion there is fusion or union of two separated tooth germs basically, right? Now the next topic is concrescene, right? In concrescene what happens, it is a form of fusion only, right, which has been occurred in the later stages, you can say later stages, or which occurs after root formation has been completed, right? In concrescene what happens, there is fusion of roots only via cementum. Cementum is the outer layer of the root, right? You know that. So there will be a fusion of roots only via cementum. So C for concrescene and C for cementum, right? It is a form of fusion. Now the next topic is dilaceration. In dilaceration what happens, there is a sharp bend or angulation, you can say, or curve in the root, more commonly, or crown of a formed tooth. Here in this picture you can see a sharp bend or angulation, right? So this sharp bend can occur at any place, that is either cervically or apically or or midway along the root or even at the apex, right? So this is basically a sharp bend along the length of the tooth. Now the next topic is Talon's cusp or Talon cusp, right? This is an anomalous structure which resembles an eagle's talon. That's why the name Talon's cusp, right? So here in this picture you can see a proximal aspect of an anterior tooth, right? So this portion, as we know that this is cingulum. So in Talon cusp, right, there is a structure which projects lingually from the cingulum portion areas of a maxillary or mandibular permanent incisors, right? So this portion, this projection is known as Talon cusp from the cingulum portion, right, of the anterior teeth, that is maxillary or mandibular permanent incisors, right? It is associated with Rubinstein-Tebby syndrome. This syndrome, there occurs developmental retardation, broad thumb, large toes or great toes, you can say, right? Delayed or incomplete descent of testes in males and stature, right? Head circumference and bone age below the 50th percentile. These are the features of Rubinstein-Tebby syndrome, which is associated with Talon's cusp. Now the next topic is dens in dente, right, which is also known as dens in vaginatus, dilated composite odontome. The term dens in dente means there is tooth within tooth, right? But this term dens in dente is basically a misnomer because, right, this is a misnomer because it resembles as if there is a tooth within a tooth, but there is no tooth within a tooth present, right? Now it arises as a result of invagination in the surface of tooth crown before calcification occurred. So basically at the time of development, what happens? There is basically an invagination of enamel organ inside the dental papilla. So there will be an invagination or deepening of the enamel organ inside the dental papilla, which results in dens in dente, right? This condition is more common in permanent maxillary lateral incisors, right? So here you can see a pit in the lingual portion of the crown, right? So this is known as lingual pit. It resembles like a lingual pit. That's why we call it as a lingual pit. This is formed due to invagination in the crown portion of the tooth, right? It occurs only in mild forms, right? But in severe cases, what happens? This deepening or this invagination can involve the root portion of the tooth also, right? So in that case, that would be the radicular variety of the dens in dente, in which the root portion of the tooth is also involved, right? Now the next topic is dens evaginatus, which is also known as occlusal tuberculated premolar, Lyong's premolar evaginated odontome, occlusal enamel pearl, right? So in this picture you can see basically an accessory cusp present between lingual and buccal cusp of a premolar. So in dense evaginatus, it basically involves premolars, right? So there will be an accessory cusp present in between the cusps of the premolar. This is the proximal aspect. So in dense evaginators, what happens? There is a proliferation of enamel organ, you can say, or the area of inner enamel epithelium, and subjacent odontogenic mesenchyme into the dental organ, which results in dense evaginatus or an extra cusp in between the buccal and lingual cusps of the premolar, right? So the next topic is enamel pearl. In enamel pearl, there is basically an ectopic formation of enamel in the form of a globule on the root surface. So basically enamel is present on the crown portion of the tooth. But what happens in enamel pearl? There is a part of enamel which is present on the root surface, right, which is known as enamel pearl. It is in the form of globule, right, which is 1 to 3 mm in diameter, right. It is more commonly located at the level of CEJ or in the cervical third, right. This is the cervical third part of the root surface, right. So there is a localized developmental activity of Hertwig's epithelial root sheath cells, which leads to the formation of a globule, which is known as enamel pearl. It is yellowish white or spherical globular structure. It is adherent to the furcation area of the root surface, right. Its diameter is 1 to 3 mm, right. It is more common in maxillary third molars followed by mandibular molars, right. In radiographs, there will be a radio opacity present, right. Radio opacity due to this enamel pearl, right. So there is a clinical significance that we can mistake it for calculus. So we should remember that enamel pearl is also radio opaque, which is present at the cervical third of the root surface at the level of CEJ, which is 1 to 3 mm in diameter, right. Now the next topic is taurodontism, which was given by Sir Arthur Keith, right. So in taurodontism, what happens? The body of tooth is basically enlarged at the expense of roots. Normally the tooth, here you can see there is a crown, root portion, furcation area, which is near the CEJ, you can say, right. But in taurodontism, what happens? The crown, the body of the tooth is enlarged at the expense of the roots. So the furcation area is basically present apically, right? Apically. So it is basically also known as bull-like teeth because it resembles the teeth present in cut chewing animals, right? That's why the name bull-like teeth, right? It is classified into hypotaurodont, mesotaurodont and hypertaurodont. This hypotaurodont is the mildest form and hypertaurodont is the, you can say, the severe form, right? In which what happens, the furcation area is present or it occurs near the apices of the roots, right? It is basically caused by failure of Hertwig's epithelial root sheath, that is HERS, to invaginate at proper horizontal level. That's why the furcation area is present below the level of, below it is present normally, right? It is present near the apices. It is associated with Klinefelter syndrome, right? Or also it is associated with amelogenesis imperfecta, right? So the molars are more commonly affected, either only a single tooth or several molars of the same quadrant, right? So molars are the more commonly affected tooth in taurodontism. So the next topic is supernumerary roots, right? So supernumerary root means there is an extra root present in a single rooted tooth, right? So this is, you can say, anterior tooth which is having only single root, as we know. But in supernumerary roots there will be an extra root present, right? In single rooted teeth may have extra root, even bicuspids and molars may have extra root. So this is also a developmental anomaly. Thank you.